This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I have got Jeff Kohl with me. You are with the Mental Health Support Project Program with ConnectWell.
That's right.
Now, we think you've been here. You were here before. I knew I recognized you. You were here before, we think, with the Recycle program.
Many years
Long time ago
when I was working for the County of Lanark, coordinating the recycling program. So it's been a while since we've spoken, Kathy.
All right, but you're back. You're back here with a different hat on today. We're going to talk about that too.
Great.
You're here to talk about a peer support program that you've got going on.
Right. We're the Mental Health Support Project. We've been working out of 88 Cornelia Street in Smiths Falls for probably 20 years now. I know we're a well-kept secret. But we provide mental health peer support for adults who are 18 and over. And by peer support, we're talking about encouragement, validation, helping people work through options and questions that they may have in their lives, and generally walking along beside people. We have 2 full-time staff. And Andrea and I have both had our own challenges with mental health in the past and have sort of come out the other side, taken a lot of training on peer support. We're both accredited with Peer Support Canada. And we just provide a whole range of programs for adults.
All right, so I got so many questions. How do people get referred to you, or do people self-refer?
People can self-refer.
Okay.
We often get referrals too from Lanark County Mental Health and Rideau Community Health Services, and people find us through all kinds of different avenues. There's no need for a formal referral. We don't do a really onerous intake process. If you want support on your mental health journey, you can just call or email us, and we'll try to find the best fit for you.
Now, would you be a place somebody would come to after a diagnosis, or somebody just knows I need help?
It could be either.
Could be either.
So we're not that concerned about people's diagnoses.
Okay.
We'll take that into account, but we more just work with the person wherever they are at. So yeah, we don't need to get involved after a diagnosis. People don't need a formal diagnosis. They can just say, I'm not feeling right, I want to talk to somebody, I'm feeling lonely, isolated, anxious, depressed, whatever the word may be for them. And we'll provide them emotional and practical and support and encouragement.
Okay, so do you do one-on-one as well as peer support?
Yeah, we do. So I brought our calendar, but we provide one-on-one support, and that can be in person. It can be telephone. It can be over Zoom. We provide a lot of structured group programs. So we're running a program now called Stepping Stones to Wellness, and it's a 10-week program. We're in about week 7 of a program right now, and we just walk people through a bunch of exercises to improve their mental health. And I think what people find of the biggest benefit really is going through that process with a group and not feeling so alone. I think especially what we've noticed is since the pandemic, people haven't really reestablished their social habits, and there's a lot of isolation out there.
That's right. And when you have a peer support, you've got, how many people would attend at one peer support group, what would you say?
Well, our group that's running right now, it varies, but we usually have about 8 to 12 people in a group. So there's the Stepping Stones to Wellness. There's a program called the WRAP program that stands for Wellness Recovery Action Plan. And that's more a group program for people who have been or are at risk of being in some kind of crisis. So you work through coming up with a crisis plan. If things really go off the rails, who's going to walk the dog, who's going to bring in the mail, who's going to pay the bills, and then working on towards a post-crisis plan. Whereas the Stepping Stones to Wellness is maybe not quite so formal. What else do? We have an art program. We have a cooking program. We do one community meal every month, and sometimes we'll play board games afterwards, or we'll do a sing-along. I lead a sing-along every month or two.
And some of this support isn't always having to talk about it either. It's just being with somebody.
It's true on the days when we do drop-ins, sometimes we just put out a bunch of doodle art,
Yeah.
and we sit together and we doodle and draw and chat and have a coffee or a
Just
juice.
know I'm
and
here for you, sort
yeah,
of thing.
I'm here for you.
Yeah.
And when you want to talk, we're ready to listen. We do a lot of listening as peer support workers. We have this acronym, which is WAIT, which stands for Why Am I Talking?
Oh, I
Because-
like that. Wait,
because-
I'm writing that down,
Right?
Jeff.
It's
Why am I
off
talking?
because it's really
Yes.
often about giving the people that we're supporting a chance to talk, to sort out their feelings, to try out some new ideas, and we're there to encourage them to maybe explore options.
With each other too? I'm assuming.
Yeah,
I don't know,
in the
sometimes
group-
you're waiting, you're not talking, and they could be helping each other.
Well, what I love, the magic for me is when people in a group start to exchange contact information, because they've started to feel comfortable enough with one another
Right.
that they now are forming connections outside of us. And that to me is magic.
And your mental health journey is 24/7.
24/7,
Yes.
and I think they say 20 to 25% of all adults have some diagnosis or other, but I would wager that it's a much higher number if you include people who have had bouts of depression or extreme anxiety. So I view mental health as a continuum, right? And
Absolutely.
we're all somewhere on that continuum.
Everybody.
Everybody, right?
Yes.
And I've been doing this peer support for 4.5 years, and I love it.
How did you get into it?
Well, I got into it because I had a very stressful job before this job, and I realized that my mental health wasn't quite robust enough. I wasn't quite resilient enough to handle the stresses of a high stress, high productivity job. And that job came to an end, and I was fortunate enough to see a job posting for a peer support worker. And one of the criteria was must have lived experience with mental health challenges. Ideally will have worked with groups of people, and obviously you had to be a good communicator. And I didn't really know much about peer support at all until I saw the job posting.
Wow. Wow. Good
Yeah.
for you. And it just, a light went off.
Yeah,
Light went
yeah,
off.
it's been really good. And it's also great to work for an employer who understands that every now and then I might need a day just to take care of my mental health.
That's right.
And they're very supportive that way, which is fantastic.
Absolutely. Absolutely. Now, do you find when you're doing these peer support groups, is it different people a lot, or is it same people, or how
The structured group programs, it's mostly new people, but we have a couple of people this time who have taken another program, and
Right.
then they come and take this program. It can happen that somebody will do a program more than once, and they find they get a deeper understanding the second time through.
But I was reading on your website yesterday about your program, and the words respect and dignity popped up a few times, which I really like.
Respect, dignity, judgment-free.
Yes, yes.
That's huge. So when I'm working with an individual, I may not agree with all of their choices, but in the end, it's their choices. And so the best I can do is listen, and maybe sometimes encourage them to consider some other options, but at the end of the day, we acknowledge it's up to them. It's their wellness journey. It's up to them to decide what works for them.
Wow. Wow. This is amazing. This is an amazing program that you've got going on here. And you are, what did you call it at the beginning, a little secret in the back of Cornelia Street?
Oh yeah, we've been a well-kept secret.
Yes,
Right,
my goodness, you
right.
shouldn't be. You shouldn't be. We got to get people knowing about you guys.
It's
so-
true.
yes.
We'd love it. We'd love if people would call us. I'm sure you'll put the numbers up when we're done, but people can phone us at 4608. And you can email us at MHSP, that stands for Mental Health Support Project. So mhsp@connectwell.ca. And just reach out, just say hello. You can ask for a calendar. We'll give you a call. We'll find out what your situation is, and we might recommend a group or a program, or sometimes we'll even just say, why don't you drop in when it's a really casual drop-in or an art program, just so you can meet the staff and see the facility and ease into things.
Absolutely. And I mean, ConnectWell does so much. So much. You just can call them and they would give
That's
you the,
true.
yeah, you know.
Yeah, there are many pathways
Oh my
that
goodness,
lead
everything.
to us.
Yes,
Right.
that's exactly it. Many pathways that lead you to you. Well, I thank you very much for coming here today. Jeff Kohl, you are with the Mental Health Support Project Program with ConnectWell. Thank you very much for coming here and telling us more about what goes on. You need to come back and tell us more about this.
I'd be happy to. Thanks so much, Kathy. We appreciate the exposure.
Thank you very much for being here and what you do.